Let's see those pearly whites.
Yeah, those ones back there. Oh, where are they? Those are my
Nice.
favorite ones.
So, you have to be, I guess, in your field. That's like the number one thing you guys are looking at, right? Like the first thing is teeth.
Well, yeah, the whole oral cavity, definitely we do the whole health of the mouth, but the teeth are the primary thing we look for. The teeth and the gums. The gums are actually more important than most people realize. Yeah.
Yeah. And when you see bad gums, is it usually because of smoke? People usually smoking?
You know what's really interesting about that? Not always, because smoke, when people smoke, a smoker actually, the smoke it constricts the blood vessels in the gums. So sometimes the gums appear to be healthy when they're really not. So smokers, we always say, please tell us you smoke because we can overlook signs of gum disease sometimes when you smoke because it kind of like masks it, it hides it. So it's kind of interesting. Who would have thought?
Hmm. So were you
Hmm.
born with a blessed grill, or was it did you have braces as a kid? How that all
Oh,
end?
you sound like I actually had braces twice. Oh my goodness. Yeah. So no, I was not. My teeth were all over the place. I'm very lucky. I mean, I've had a few cavities, right? Like some people are just more cavity prone, right? Like especially on my chewing surfaces. If you have groovy teeth, sometimes there's nothing. You just have groovy teeth. You can brush and floss till you're blue in the face, and if you're cavity prone, you have to. So no, I wasn't. I don't have the best teeth in ever, but I'm pretty lucky. I do have not too bad teeth. My gums are healthy, so I'll take what I can get.
Well, it's. I don't think a dental hygienist has ever had bad teeth.
That's one of my number one questions in my YouTube videos is, can I be a dentist or can I be a dental hygienist if I have bad teeth, right? And
Yeah.
my answer is always yes. You'll actually make the best dentist and dental hygienist if you don't have great teeth because you'll understand and you'll have empathy toward people trying to fix their mouth because like you did or are going to or whatever the case is. So it's not a prerequisite. I think we just through time, if you worked in the dental field long enough, you have your accessibility or you have the tools to the ways to get a better mouth, right? But it doesn't necessarily, you don't need one to enter the field.
And why did you enter the field? What's it about dentistry that you just look at the smile on your face? You just
Oh,
love it,
that's
right?
so nice of you. I just, some people just like talk with their teeth and I just can't help it. That's how I talk. But, I always liked going to the dentist as a kid. My dentist was so cool. She was like a younger female, cool doctor. Right. And I was like, oh, I want to be like her. And I didn't even like, I
Wow.
just wanted to be her. I didn't even think about like teeth. And I just stuck with that my whole life. And, went to college, undergrad in biology and chemistry, knew you needed a lot of science for dentistry, still had that in my mind. And then that's when I started shadowing dentists and getting more serious with it in my undergrad. And then I found out that dental hygiene was way more interesting to me because of the preventative aspect, right? Dental hygiene is all about preventing gum disease, preventing cavities. Dentistry is all about fixing them. If you're a dentist, you fix the stuff. If you're a hygienist, you prevent the stuff. And anyway, I fell in love with dental hygiene instead of dentistry, and here we are. The rest
And
is history.
and as a kid, like you had to put me in a straitjacket to go see the dentist.
It's such it's a thing, right? Like dental fear, dental anxiety. It's unfortunate if you have a bad experience, it sticks with you. And it's hard to explain to a young kid, like, oops, you had pain that one time, but you'll never have pain again, I promise. Like you associate it with the dental chair. So it's hard. We do everything we can nowadays, like to make sure kids are comfortable because we don't want to traumatize them. We want them to keep coming back as adults.
Yeah, for sure. I remember the
Yeah.
first time, my first experience was I was like 12 or 13.
Okay.
And
Yeah.
yeah, and the initial one was like, "Oh, Mike, you've got three cavities."
Mm.
And I was like, what do I do now?" And they're like, "Yeah, we're gonna be drilling your teeth and getting in there, in your next visit." I was like, "What?" So here comes this big old syringe that just uh took my mouth over, and then dude starts drilling the teeth, and I'm like, "What is happening? This is the worst place on earth, right?"
Oh, yeah, because you're like, what?
Yeah. What did I do to
Yeah.
deserve this? I mean, I knew what I did to deserve it, but still, I was like, man, yeah. So that's good. You got the right
But
attitude. Right? Go ahead.
no, go ahead. I was gonna say, but not always, not always. Like I said, like, so yeah, a lot of people don't floss, a lot of people don't, but sometimes you could do everything in your power, and some people are just more prone. They need to come more frequently. There's so many different, I never want people to feel bad that they have bad teeth because it's a thing, and we just, some people have to work harder than others and it stinks, but we're here to help you with that.
It's cool. All right, where are you? You're
Yeah.
based in Illinois?
Chicago. Yeah. South suburbs of Chicago. Yeah. Yeah.
Are you working today? Today's Saturday.
No. So this is my home office.
Is it?
So
It's a
it's like a
studio?
studio. Yeah. 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 So this isn't the real, this is where I film my YouTube videos. It's the chair doesn't work. Like I don't do dentistry.
That is
So
incredible.
yeah, this is just where I work, but like as a YouTuber. But my real office is at a real office.
That is so cool.
Yeah,
Okay,
that's
let's talk
funny.
about the YouTube stuff. I think you've got over 250,000 subscribers now.
Wild. Yeah.
What did like what was that first video that kind of popped off and you said, "Wow, I might have a chance here."
Good. So I don't that's a funny I don't think I ever had like a one viral video. I think I just kept going and going and going until like it was consistent. So like I know a lot of people have that like viral video or the one that like they were like, okay. But yeah, I think my first video I ever made was what's the best mouthwash? And I just talked about how there's different mouthwashes and there's not a one size fits all. And I gave like examples of all different types and which one might benefit you, things like that. And I just got a lot of comments on that video, questions to make more videos, just anything. Like everyone, just the comments started flooding. Like, can you make a video on this? Can you make a video on this? All these different dental topics. And I was like, oh, okay, I'll just keep going. And like, they all got like steady views, but nothing like popped off. And then I think maybe like a year in of like consistently making videos, I started seeing like my older videos started getting more and more and more. Like, I don't know, it just all kind of happened. I think it was organic. I'm very happy that I just kept going because yeah, there wasn't just one video.
Yeah. So the
Yeah.
key and the algorithm, I guess, at this point is just keep making videos, keep doing it.
Perhaps, right? Like, I mean, that's what's hopefully slowly but surely kind of happening for me. And yeah, I think what keeps me going is more just like those comments, people that like really have been helped. Like I'm just so happy that I could provide some information for people that maybe just didn't get it before. And that's what keeps me going more than numbers, you know what I mean?
Yeah, for sure. When did you start
Yeah.
making the videos?
So my first video ever was in 2015 before I was a dental hygienist. I just graduated and I wasn't working yet. And so I made that video, and after I got my license, my dental hygiene license, I stopped making videos. So like although my first one was in 2015, I didn't make videos because then for a while, because I had my dental hygiene license and I was working in the office chairside cleaning teeth, but then I missed it, right? So then I probably went back to making videos around 2018. So I've been doing it consistently since 2018.
Okay.
But my first video was like years before then, but I was in that working world, right? Then I was like, wait, I missed the videos.
Well, and
Yeah.
and things are now geared for that short video too, right? You got TikTok, you got Instagram, you got
Oh
YouTube with the
yeah.
shorts and the reels and the TikTok video.
Mm-hmm.
So your stuff is perfect. And you would never think we've got, I don't know how many teeth we have. How many teeth do we how many teeth?
32 for an
32.
adult.
Now we've got 32 teeth in our mouths, hopefully. And
Or
it's
28. Most people have 28 if you got your wisdom teeth out, right? Because
okay.
most people get their, but anyway,
Okay.
regardless.
But look at all the topics you can talk about.
Yeah, it's a lot, right? And it's not all about teeth too. That's what a lot of people are like, are you gonna run out of video topics? I was like, never. I have like a list of like over 800 right now. Like that I just like it's wild. And then I'm like, I can't do them all. Like I do 2 videos a week, right? So, but and then there's topical things that come up, right now the making your own Coca-Cola at home is like a big thing. Like there's always topics that relate to teeth that come up in current events. And so I'm always kind of pushing my video list aside. So there's always stuff to talk about. And it's not only teeth. There's like canker sores and cold sores. And there's a lot of things in the mouth to talk about. The tongue and taste buds and taste and what happens if you burn the roof of your mouth. And there's just so many things in the oral cavity to talk about. Yeah.
Say Coca-Cola. People are making Coca-Cola at
Yeah.
home.
Do you see that on TikTok? People are using like balsamic vinegar and mixing it with like seltzer water and saying it's better because there's no sugar. But like the dental term, the long story answer in the dental world is it's not any better for your teeth. Like the acidity in vinegar is just as bad as the acidity in Coca-Cola. Just because there's no sugar, the acidity still ruins your teeth too. So
Okay. Talk about acidity.
although it might be better for your overall health, it's not great for you. Sorry,
Yeah.
yeah.
Acidity. I'm a hot water lemon guy in the mornings.
Okay.
But I
Hey.
I know the lemon is not that great for your teeth, right? Is it
Sure.
best to like brush your teeth after you're done drinking it?
Good question. Not at all. Opposite. don't brush after eating acidity, or after eating anything acidic or drinking anything acidic. You want to wait 30 minutes. Your enamel's super weak in that time, and you don't want to like brush it away. So the best thing is to wait 30 minutes, and or drink regular water right after. So like, say you had your, that's pretty healthy, right? Like water with lemon, it's like for your body, right? After you're done with your lemon water in the morning, drink just like a sip of regular water, swish it really good, so then you can get some of that residual lemon off your teeth, right? You want a neutral. Water is like the best thing, so just swishing with water works too.
Good. Nice. Talk about
Yeah.
swishing. I'm a huge mouthwash guy, but
Oh,
recently I've heard, who doesn't like a nice fresh mouth?
yeah,
Recently
I hear
I've
you.
heard that there are some that are not good for you. And is it
Yeah.
those that have alcohol in them?
Yeah, unfortunately. So like alcohol, and especially how you said you like the fresh breath and the fresh, a lot of people like the alcoholic mouth rinses because you feel the burn, right? You're like, oh yeah, I feel the burn. But unfortunately, alcohol does dry out the mouth. So in turn, dry mouth can actually cause cavities, which is wild to think about. It's not that mouthwash is causing cavities, but mouthwash, if it causes dry mouth, some people that's what it does when it has alcohol in it. It can increase your risk of getting cavities if you eat certain foods after. My point is, always use a non-alcoholic mouthwash if you can. There are a lot of great ones out there that are minty fresh and they feel really good. If you find the right, you just find the right one. But
Yeah.
if you love alcoholic mouth rinse, it's not the end of the world, right? Just rinse with water after. Like I said,
Okay.
make sure you rinse with water after, which is
Okay.
wild. But
What's your
mhm.
go-to at your place for mouthwash?
I like fluoride anti-cavity mouthwashes. So I think you can't go wrong. Most of them are alcohol free. So as long as you find something that says fluoride or anti-cavity, that is my go-to, because I believe, from research, what I've read, what I've gathered is you can't go wrong with a fluoride mouth rinse. It's not gonna, it only helps. Whereas alcohol mouthwash that's like for the gums and healthy, all that fresh breath, those things are usually like a red flag. Like they're not always what they say. But the fluoride anti-cavity, no alcohol, that is the go-to. You're safe using those. And with those, don't rinse with water after. You want that fluoride on your teeth. You know what I mean? That's what my first mouthwash video was all about in 2015. Like, there's fluoride anti-cavities and there's antiseptic like gum ones, but go for the cavity ones, anti-cavity ones.
And those have no alcohol in them usually?
Most of the time they don't, but you do have to confirm. Yeah, just check on the bottle. It'll say usually no alcohol,
Right.
right on it. But yeah.
I
I
want to
know
go
the
back.
mouthwash aisle is so overwhelming. You walk it and you're
Yeah.
like, what?
I know. It's a beautiful aisle though. It's like all bunch
Yeah,
of beautiful different colors. Yeah.
very colorful.
Uh, I want to go back to the 32 teeth compared to 28 teeth. And
Yeah,
it's the wisdom thing. So,
yeah.
as a kid, again, it's always like, oh, you have your wisdom teeth, you got to pull them out. So some have their wisdom teeth, some don't. Why do some have them? Why do some don't?
Good question. I think that's more of an evolution question than a dental question, honestly. But some people are just congenitally not born with them, right? Like just like anything else. I mean, it could be genetic. Like, some people's earlobes are different, or something. That's more the question of why is, what do you do if you don't have them? Is that bad? Not at all. You probably dodged a bullet. Just kidding. That's it. But it'll save you money if you ever need to get them out. Having said that, if you do have wisdom teeth and they come in perfectly straight and you're able to reach far back there and clean them properly, you don't necessarily need to get them out. I think it so happens that most people need to get them out because most of the time they don't come in straight. They come in all the wrong ways and you can't clean them properly. You're going to get cavities. That's where they don't just pull them out because you shouldn't have wisdom teeth. There's a reason. It's okay to have them. They just unfortunately tend to come out not the right way.
And I know they'll be
That makes sense.
pushing your teeth too and make them
Mhm.
crooked, right? They'll kind of go over each other.
They can cause a lot of havoc. They wreak havoc in your mouth if they don't come in properly. But
Mhm.
the whole evolution thing is why is our jaw, is it getting smaller? Did it used to fit in the mouth? So that's a whole thing, but that's not my expertise. But my expertise is finding, ooh, these fit in good, you're okay, or oh no, these are not going to work. They're going to screw up the rest of your teeth. Let's just get them out.
Mhm.
So
Can we talk
yeah,
about some myths?
sure. I love myths. Ooh.
Hydrogen peroxide whitens your teeth. Yay or
Mm.
nay?
Ooh. I want to say nay right away. However, I want to say yay as well. Here's the thing about it. There's a lot of messed up misconceptions on TikTok right now, because using hydrogen peroxide from the bottle, like, like the like 99-cent bottle of hydrogen peroxide versus using like whitening strips that have hydrogen peroxide in them, those are two entirely different things. Yes, hydrogen peroxide that is properly formulated for your teeth in a whitening strip form will whiten your teeth. Hydrogen peroxide is what whitens your teeth, but it has to be formulated properly. If you're just swishing with hydrogen peroxide from the bottle, that's not going to do anything. It's only going to hurt your mouth, because too much hydrogen peroxide actually kills the good and the bad bacteria in your mouth. So if you're swishing, because think about it, with white strips, you're just putting them on your teeth, right? They're formulated, one, properly, and two, they're only going on your teeth. When you're swishing with the whole bottle, it's getting all up in your tissues. It actually could cause something called black hairy tongue, because when it messes up the bacterial flora in your mouth, it can mess up all whatever. Long story short, it messes up the bacteria, and then you have like a bacterial situation going on in your mouth. And people come in. I have patients all the time that'll come in and be like, my tongue is black. What's going on? I'm like, have you been switching with hydrogen peroxide daily? And they're like, yeah. I'm like, stop doing that. It'll go away.
Huh.
It's crazy. So although hydrogen peroxide swishing is okay in some cases, there are times when it's recommended. It's never a daily use for the rest of your life. It's going to cause more problems than good in the future. If you want to whiten your teeth, yes, hydrogen peroxide is what does it, but you have to use it in a concentrated formula of white strips. Or there's gels, there's different, gels and office whitening, but it has to be, for whitening.
And they work, you're saying the strips do work?
Yeah, I mean, they do. I always recommend to find an ADA approved strip. So the ADA is the American Dental Association. They put like a coat of seal on products, toothpaste, floss, toothbrushes. They do it on all dental products, but they do it on whitening products as well. So you just go to the ADA, the website, and American Dental Association, look up which whitening products, are approved, and you can't go wrong there. They're proved to be effective and safe, versus like scrolling on Instagram and being like, oh, this says it has peroxide in it. You don't know. You got to find something that's been, proved.
Yeah. Toothpaste overnight for that pimple. Yay or nay?
I just did a video on this.
Yeah.
No, that's so funny. I just did a video on this, and I like kind of was reading all about it because I didn't know too much about it, but now I do because I was reading about it. But so although back in the day that was a thing, like, maybe it could work, it could actually, that's when toothpaste didn't have all the additives it has now. So like back then, our grandparents might have told us like, yeah, I always put a little toothpaste on my pimple. And nowadays there's so many additives in toothpaste that you're not just putting a little toothpaste in there. There's a bunch of stuff, and there's a whole list of stuff. But long story short, you could wake up and have more issues because you just like, maybe you got rid of that one pimple, but now all around it is all like red and infected because your skin does not want all these extra additives on it. So toothpaste, no, nothing is just simple anymore. Unfortunately, you have to buy like a skincare pimple zapper to do it right.
Is there a cleaner toothpaste that you can use for that?
I mean, you want to find something that doesn't have whitening, that doesn't have sensitivity, but all the toothpaste now, they literally like have so much in them. It's hard to find. If you're gonna really do it, try to find one that like doesn't have anything. Like it's just like, but it's gonna be hard. I can't even. I've even looked in the dollar store to see if there's like very simple, just like anti-cavity toothpaste, and they always have something like extra, So I don't think it's worth it.
What's your go-to toothpaste, by the way?
Anti-cavity, fluoride. So anything that's ADA approved. Excuse me, that's ADA approved. So you're gonna go on that ADA website again and make sure that it works, and then that it has fluoride in it or hydroxyapatite. I've been getting into that lately too. There's some people that aren't into fluoride. I am pro fluoride, but if someone feels differently and they want to use a fluoride alternative, the best alternative is hydroxyapatite, not xylitol. A lot of people, I'm like throwing out all these words, but if you don't know about this stuff, you're probably like, well, what the heck is she saying? But no, the reason is there's a lot of people use xylitol toothpaste instead of fluoride if they don't like fluoride, but there's no like research to show that xylitol does what fluoride does. There is research just to show that long word hydroxyapatite toothpaste is pretty good. It's just almost as good as fluoride, and it's not ADA approved yet, but those are my go-tos. I love fluoride toothpaste, and I always recommend my patients use fluoride, but if they want to use something else, they could try hydroxyapatite, that mouthful.
Okay, good to know. Now this
Hmm.
this last one, I hope you don't take it the wrong way, but I'm mentioning it because you mentioned it on one of your videos. Is semen good
Oh.
for your teeth? Yes or no?
Oh gosh.
Had to go there.
I had no idea where you're gonna go with that. I'm actually happy. No, I know that one. No, you know, that's been a big thing going around. So the quick answer is semen is not bad for your teeth, but it is not good for your teeth either. It is just neutral. It's if you, for whatever reason it gets on someone's teeth, it is not bad. It's not going to hurt them, but it's also not good. It's not gonna like cure cavities because there was like all these like false statements out there saying that like semen on your teeth can get rid of cavities, and that is not it. It's just that it doesn't cause cavities because it's not acidic, right? It's just neutral.
That's
So
like a
that is the
bunch of
answer.
dudes. Yeah, there's like a bunch of dudes getting together and be like, hey, let's bring this rumor out so we can tell our girls that semen is good for our teeth and our mouth. Yeah.
Exactly. It's so silly. Oh my gosh. But yeah, I don't want anyone to feel bad about it. It's fine on your teeth, but I don't want anyone to feel good about it that you need to do it because no, yeah, you got me. No. But yeah, I do have a video all about that going into the science if you want to check that out.
Yeah. What did I miss? Did I miss any other myths?
Oh my gosh, so many. You could go on and on. Charcoal is bad. Don't use charcoal toothpaste.
Hmm.
It's really trendy, but don't even do it. I could talk about that for hours. So you don't want to get me started. But and then uh what's another? Oil pooling does not replace brushing and flossing. A lot of people like oil pooling. That's fine. You can use it as an additive to brushing and flossing, but you definitely cannot replace brushing and flossing with swishing with oil. Those are some that come to top of mind, but there's a million.
Yeah, those are
I
good
try to
too.
debunk them all on my YouTube channel.
Yeah. Again, mouthwash, fresh mouth, fresh is big. I just it feels so good, And for me, it's brushing my teeth, it's flossing, it's scraping my tongue, it's mouthwash. Did I miss something, or is that it?
I love it. You remember the scraping your tongue, brushing, flossing,
Yeah.
tongue scraping. Those are my three holy grails. But the mouthwash you don't need, right? Like I said, like it's a fun additive, but you don't need to. But yeah, the brushing, the flossing, the tongue scraping. And the thing with flossing too, I mean, if you're interested, if we're talking to the thing with flossing is some people really have a hard time flossing with traditional string floss, right? The motions can just be difficult or hard. I just always want people to know, like, don't be discouraged if that's just not your thing. There are flossing alternatives in a sense, right? You can use a combination of those little picks, the floss pick, like it's like it has a little plastic and it helps you just go up and down. You use a combination of that plus a water flosser. That's like ideal. Like if you like that, I'm all for that. There's also these things called inner dental brushes. They look like little Christmas trees. They're like little bottle brushes, right? And they go in between your teeth, and those work really well too. Like there's a bunch of different ways to clean in between your teeth. It doesn't have to be floss. That's something I try to explain on my channel too. Just I don't want people to feel bad, like I don't like flossing. Well, there's other things. There's other ways to clean.
The water pick, you're so right. I have a water pick. I haven't used it in so long though. I think because I got to
Hmm.
plug it in and I forget to plug it in, but the water pick is so good.
Yeah, water flossers can really help your gum health. That's what's really cool about the water flossers. They can keep your gums healthy. And now we were saying the gums are really important. The thing about water flossers, however, is they don't always help against cavities like
Mm,
the string. So just always remember, if you're using a water flosser, try to at least do that pick too. You got to get something to really get up there
yeah.
as well. But
So
I do
Whitney,
love water flossers.
what if you're on the go and you got this big meeting and your breath smells like hell? And like, what do you do? Like, what's the tip?
Good. I have a bad breath video that I have one that's like for chronic bad breath, and I go over all the ways to prevent that from happening, to prevent you from getting in that situation in the first place, right? There's like long-term things you can do to not be in that position. So I have a video of that. But if you are in that position because you weren't able to do any of the long-term things and now you have bad breath in a pinch, there honestly, I love so I was just like bashing xylitol as a fluoride replacement, but I love xylitol as a gum, or as a mint. Xylitol mints and gums. It's with an X. Xylitol. It's spelled with an X. In case like if someone
Yeah, looking for
wants to Google it, it's with an X. It's like XY xylitol. The mints and gums. Not only do they help with giving you fresh breath for a second, they also help reduce dry mouth. So like dry mouth is like one of the number one causes of bad breath. So if you can like either suck on that mint or chew on that gum, that'll really help you in a pinch. If you're like, why is my breath so bad? Now, yeah, I love xylitol gum and mint. Drinking water, swishing with water, of course, helps. You know, it'll not for a long term, but if you really want something in your mouth, I would say the xylitol mint.
Is
That would be
that
my go-to.
the only mint or gum that you chew?
Anything sugar-free is fine, right? Or different types of sugar, you know, you don't want, like, I know there's a lot of gums that say sugar-free, but you got to check what they got in there. Like xylitol is a great sugar substitute. Um, yeah, I usually tend to go to the xylitol, but there's probably other sugar-free things. You don't want sugar if you have bad breath. That's going to make it worse. It has more sugar, gives your mouth more, the bacteria in your mouth, the bad breath bacteria, more things to thrive on. So sugar is going to make your bad breath worse. So you want to make sure you stay away from that.
Cool.
Yeah.
How about a toothbrush? Soft or hard? Does it matter?
Soft.
Yeah.
Yeah, always soft. I
Because
know.
it gets
Although,
in areas, right? The soft gets in areas.
for sure.
Right?
And soft, some people do hard or firm or medium bristles because they feel like it does a better job. It doesn't. It just hurts and brushes away your gums. Um, Although you may feel like it's doing a better job on your teeth, it's not. The soft bristles are designed to do an effective, good job. So you want to be gentle. You want to clean those teeth gently with a soft toothbrush. If someone really wants that extra like feeling of clean, I would say use a electric toothbrush. Almost all electric toothbrushes now have soft heads, soft bristled heads. So if you want to feel that like something happen, use an electric toothbrush with a soft, you know, that'll help. Yeah.
Well, plus we tend to like brush real hard anyways. So if we're brushing with a soft, it's better than brushing with a hard because, like you said, it's gonna eat up your gums, right? With a hard brush.
Totally. You can literally brush your gums away, which is so unfortunate because gums like don't grow back early. You know what I mean? You need like a procedure for gums to grow back. So once you brush them away, your gums start receding. You've heard of gum recession and stuff like that. Not good. So yeah, you want to be very gentle.
I
Yeah.
don't know if you're married, single, dating, but when you're going out with guys, are you ever like, oh yeah, that's not gonna work?
No, I am married, but
Yeah.
I no, you know, a lot of dental people tell me that teeth are the first thing they look at when they meet someone, whether it's like just like a friendship or just an acquaintance or who it is. No matter what, they look at someone's teeth right away. And I honestly don't. I don't know if
Really?
something's wrong with me. I like don't look at someone. I think more lately, I try to tell myself to look at someone's teeth just because like I feel weird that I don't. No, I think I just look at a person's face in general and I forget. Yeah, I'm really weird. Unless their teeth are like mine, where like, you know, some people just talk with their teeth, like, right? Like, you can't help it. Like, some people just like show their teeth. But when someone's talking, they don't like necessarily show their teeth. I'm not like looking, you know,
Uh,
unless they're bam in my face. Yeah, I don't. So, no,
okay.
my point is no, it's
Uh-huh.
not like it wouldn't be a deal breaker for friendship. If I smell, so scent, you can, a dental professional, we could smell gum disease pretty well. I know what gum disease smells like. So, if I smelled gum disease versus bad breath, you can kind of tell the difference. Um, I would say something like, when's the last time you've been to the dentist? I want to help you. I think you might have gum disease. Like, I'm not, no shame in that. Like, I'm here to help. Gum disease, you want to get rid of that. I'm not trying to hurt anyone's self-esteem. If you have gum disease, it directly increases your risk of a bunch of other like heart disease, diabetes, all these things. So I think that's more of a health help. Hey, you know, can I help you? I could give you a cleaning, you know?
Yeah. And by the
Yeah.
way, brushing your gums is good too, right?
Ooh, so you know how I answer this, if like a dental person was listening, they would be like, what's she gonna say? So I, I tell kids, especially with braces, yes, you need to brush your gums, right? Because like you right at the gum line is where all the plaque builds up, especially with braces. I tell all kids that because they always miss the gum line to brush their gums. But adults, I think we have enough. I want to say like we're adults enough to understand that you don't want to scrub brush the gums because that'll hurt, right? You want to gently brush toward the gum line so you don't miss that part of your tooth
Mm.
where the gums meet the tooth. So I'm not necessarily telling adults to brush their gums, but make sure you don't miss the gum line of the tooth and you like kind of wiggle it in there. I have all these like brushing tutorial videos too on my video, you know, to like explain it better so you can like see. But yeah, so you don't want to like necessarily brush the gums, but you don't want to miss the gum line or the tooth and brush the part of the tooth that meets the gums. Does that make sense?
Yeah. Yeah.
You
It
don't
does.
want to cause recession. It's such a fine line, right? You don't
Yeah.
want to cause recession, like
Yeah.
gum recession.
Well, I think flossing then helps in that case too, right?
Of course, so flossing
Yeah.
could prevent gum disease as well and prevent gum recession from forming as well from gum disease. So anything keeping that plaque bacteria off your teeth. We all know plaque, that like white sticky stuff that brushes off. Getting that off of your teeth will help you in the long run. But you got to be the most find the most gentle way of doing it. It's such a fine line and it's annoying. I always tell my patients that are concerned, but they're like, "Hey, Whitney, telling me to brush gently, but you're also telling me to get it all off. What do I do?" I know it's like wild. My best advice is to ask your individual, like dentist or dental hygienist, show them how you're brushing and ask them, "Is this, I can't like virtually like see how hard you're pressing, but if you were in my chair, we can like go through and make sure we find the right pressure for you, you know?"
Talking about the
Yeah.
chair, would you be able to sit in the chair and clean your own teeth?
No, it's hard. Can I do a little bit? Like we all, like all my friends, like who are hygienists, like we clean each other's teeth, right? Like in the office, and we all joke, like, "Did you pre-clean your teeth before I'm cleaning them?" Because we all want to like look like we have good teeth. And like, yeah, you could tell where a hygienist like pre-cleaned their teeth and the spots you just can't get yourself because like think about how a patient is like you go like in the hygienist's lap, like you're like upside down in their mouth, so we can get all the angles. We have these loop, we see perfectly your own mouth and you're in like the mirror, you just like can't properly do the motions. You could probably do an okay job if you know what you're doing as a hygienist. I do not recommend it if you're not a dental hygienist or a dentist. You can hurt yourself very badly and cause more issues. So it's hard enough for me to do it. So I can't even imagine someone to clean my own teeth, that I can't imagine someone who hasn't been trained for 4 years of practicing and doing, you know what I mean? Like, so yeah,
Yeah. Well, that's all I got. Did I miss anything? Something that,
I love it.
yeah, something that would be beneficial to the audience?
So much. You were good. You were boom boom on the dentistry. I love it.
Mm.
No, I'm just so happy that you're interested in wanting to um, get this message out to more and more people that dental health is so important to your overall health, right? It's not just about your teeth, it's about your whole body. So, a healthy, right? The mouth is the gateway to the entire body. So, a healthy mouth gives you a healthy life. So, I'm glad that you're contributing to that message. It's awesome.
Yeah, no doubt. Thanks.